And I thought it would be just useful to reflect back on some of the activity that was happening in that service. So it's a building now where the urgent care centre, as you will see, sees more people than it used to see when it was a fully functioning A&E. It also sees between 300 and 400 patients a month receiving day case treatment. There are a number of people that receive ambulatory care on that site, which is where they go in to have treatment during the day and then go home again during the evening. And it has a range of diagnostic services and an entire floor dedicated to children's care. So it is a building we would like to use more and we want to see fully utilised, but I thought it was just worthwhile giving some feedback just to show the scale of the people that use the service. It's also interesting to note the patient feedback on the hall is very positive about it, so there's a little bit there. And unusually, the hospital's won 2 European Healthcare Design Awards and also a national award from the Royal Institute of British Architects. And this is about how we took into account the views of patients, staff and others in developing a building that was very functional and that worked for the people that were going in it. And I want to read a little quote, I have to pick it up. It was obvious to the jury that the new facility has been taken on by staff and occupied in a way that indicates they are proud of this building. Some might say that moving from old, tired facilities would automatically create a sense of ownership and pride, but this is not always the case, and this is most important in this sector of work. So I think that, we often just think about buildings as buildings, but they are environments where a lot of people spend a lot of time. So I thought it was worth sharing that. And I'm going to finish on workforce. So as Alan said, without staff and without people and without all the hard-working people that work within the CCG and across the system, none of this would happen. And we have been really clear that we have to make Hertfordshire a good place to work. And last year we touched on the need to attract and retain high-quality clinical staff. And one of the challenges that was put in one of the questions was, so what are you going to do for general practice? So that just gives an indication of what we started to do for general practice. We've developed a fellowship scheme around training GPs, and we have we have one of our new GP fellows here this afternoon. So we're investing in clinical fellows, we're investing in training, we've invested in practice nurses, and we've put in place a practice nurse mentorship scheme and training to try and improve recruitment, but also to upskill and allow people's jobs for them to feel that their jobs are more valued and that they can develop the skills they have. We've also looked at how we use existing GP and nurse leads to become tutors to try and encourage and develop others. We're now looking at what we can do in terms of encouraging the wider opportunities for careers across the patch, and looking at some of the things around general practice apprenticeships and actually apprenticeships in general for the CCG. So we are striving to try and do anything we can that encourages people to come and work for us, because Hertfordshire is a nice county to work in, and I would say from a personal point of view, the CCG is a nice organisation to work for. And as you spend quite a lot of your waking hours at work, I find that quite important. So I'd like to finish by saying I can only stand here because of the hard work and dedication of all the people that do the work within the organisation. I'm proud to work for the organisation and I'm proud of all the work that they do, but recognise that there's always more we can do. Sorry if I overran.
So we've got a short bit of time now to take any questions from the floor.
I think there's going to be some microphones, so it would be helpful if you could say who you are and your question.
Hello, thank you for the presentation. I'm Eric Buckmaster, Executive Member for Health and Wellbeing East Herts. My question really is around prevention of ill health, so I guess that's our role in the districts, and thoughts around social prescribing for activities, lifestyle change, isolation, that kind of thing.
Beverley, would you like to?
I said a bit around to ask lots of other people to ask as So that we are, I think social prescribing is quite an interesting area. We've been doing some work with public health through the local public health boards that work at a district level to look at what the options are and have agreed as a county. There's a pilot in St Albans that is due to report in the early autumn, so I think we're due to get a report in October. It's looked at social prescribing against 3 very specific areas around mental health and long-term conditions, and has invested a small amount of money up front in making that work. We are keen, if that shows that there's real value in it, to try and roll this out over the patch. But what we did was say, rather than have a scattergun approach, let's try and get some evidence and look at it. So we do allow, there are processes in place at the moment where GPs can refer into some schemes for weight management and weight loss, and also linked to the new National Diabetes Awareness Programme. But in terms of some of the wider social prescribing, that's likely to come on the back of the outcomes from St Albans. And I think in particular we'll be looking at what we can do for people with mental health issues around being able to actively engage with their community, which from the informal feedback I've had, I don't know if Raj wants to add anything, is the one bit that appears to be making a real difference to people's lives.
Just a quick point, I think this morning we had what do you call it, the self-management. My name is Raj, I'm a consultant in public health. As I say, in terms of your question, I think it's very important in terms of the social prescribing. The other aspect we're picking up is self-management support, people especially with long-term conditions. So this morning I'm kind of a meeting where we discussed the various aspects of self-management.